This is the Health Coverage Enrollment and Utilization Educational Series presented by the Health Access Program from Asian Americans Advancing Justice, Southern California, sponsored by Cedars-Sinai. We will be walking you through the various steps to apply for Medi-Cal. So, how can you apply for Medi-Cal? You can apply online through Benefits Cal. By the end of 2023, all counties will be on this website. The application is available in 19 other languages, and you can change the translation on the top right corner of the website, as you can see circled in yellow on the screen. It is best to create your account first and then start a new application. That way you will be able to see the status of your application and any notices through your online account. On the screen, you can see the Create Account button that is circled in red. You can also apply in person at your local county social services office. You should be able to look up the closest office online. When you go in, you can request interpretation in other languages if needed. Lastly, you can also apply over the phone by calling your county social services office. The application over the phone is also available in multiple other languages. An additional note is that you can apply for Medi-Cal through Covered California as well. But if you are eligible for Medi-Cal, it will likely be quicker to apply directly through Benefits Cal or by contacting your social services office. So keep an eye out for mail and make sure that you respond in a timely manner. You will then receive a final notice of action. This letter will notify you of whether or not you can receive Medi-Cal. If you are approved, you will receive your Benefits Identification Card, or BIC. When you receive your Benefits Identification Card in the mail, you are able to begin using your Medi-Cal benefits. The entire process of verifying eligibility from the time your completed application is received to when you receive your BIC typically takes 45 days. So after you have received your BIC, what happens now? You are now covered under fee-for-service, also known as regular or straight Medi-Cal, which means that you are able to use your health coverage with any provider that accepts fee-for-service, regular, or straight Medi-Cal. This is Medi-Cal that is not associated with a health plan. You will then receive a health plan selection packet within 45 days of receiving your BIC, and you must choose a health plan within 30 days of receiving the plan selection packet. Otherwise, Medi-Cal will choose a plan for you. Here are some additional notes about managed care plans. Almost all Medi-Cal plans are managed care plans, which means they function similar to an HMO. The plans that are available vary depending on which county you live in. You can choose a plan on the Healthcare Options website or by mailing back your plan selection packet, or by calling Healthcare Options at 1-800-430-4263 if you need help understanding your plan options. Lastly, if you are not happy with your medical plan, you can choose another plan, if available, by calling Healthcare Options at 1-800-430-4263 or by completing the Medi-Cal Choice form. For many individuals who enroll in Medi-Cal, there is no premium, no copayment, and no out-of-pocket cost. As a reminder, premium is the amount you have to pay for your health insurance every month. Copayment is a set fee that you pay for a doctor's visit or a prescription, and out-of-pocket costs are any medical expenses that are not covered by your insurance. Here are also some questions to consider and ask yourself when you are selecting a health plan. First, if I already have a doctor that I am happy with, does my doctor belong to a medical plan? If so, which plan? It may be a good idea to figure out which health plan your current provider belongs to, so that you can select that plan and continue to get covered care from your provider. Second, If I do not have a doctor, is there a trusted provider recommended by my family or friends? If so, which plan does that provider belong to? It might be a good idea to identify a trusted provider first so that you can ensure that that provider is within the plan that you select. Third, are there providers in the health plan who are located nearby and accessible? You want to make sure that there are providers within the health plan you are considering who are actually accessible to you based on the type of transportation that you are able to use. You should be able to search up a list of providers within the health plan that you are considering selecting. Fourth, are there providers in the health plan who speak my language or provide interpreters who do? You want to make sure that there are providers within the health plan that you are considering who are able to speak your preferred language or are able to provide interpreters who do speak your language. So, how would you select a primary care provider or PCP? When choosing a health plan, you can also select a PCP, such as by providing healthcare options with your provider's national provider identifier number. If you do not select a PCP, the health plan that you select will automatically assign one to you. Again, as a reminder, if you are not happy with your PCP, you can change your PCP. You can do so by contacting your Medi-Cal plan's member services department to choose a different PCP. What happens then after you select your health plan? Within 7 to 10 days, you should receive a confirmation letter letting you know when your coverage within that health plan will become active. Then, once you become active, typically 30 to 45 days after selecting a plan, you should receive your health plan welcome packet and insurance card. Just an additional note. Before becoming active in a health plan, your coverage will be fee-for-service or straight or regular Medi-Cal, which again means that you can use your health benefits with any provider that accepts fee-for-service or straight or regular Medi-Cal. We wanted to include a few additional notes about requesting interpretation and transportation through Medi-Cal. For interpretation, you are entitled to request it if needed. All health plans are required to provide qualified interpreters, so do not be afraid to ask for one if needed. Most health plans must provide written materials in the main languages spoken by their members. Health plans must pay for these services. Patients should not be charged. You can also request transportation, as Medi-Cal offers transportation to and from appointments for services that are covered. There are two different types of transportation services: non-emergency medical transportation, NEMT, and non-medical transportation, NMT. Non-emergency medical transportation, NEMT, is transportation using an ambulance, wheelchair van, or litter van for those who cannot use public or private transportation. For NEMT, a prescription from a licensed provider is required. You can contact either your provider or your plan's member service department to request transportation. Non-medical transportation, NMT, is transportation by private or public vehicle for people who do not have another way to get to their appointment. You can contact your plan's member service department to request this type of transportation. You will also need to attest that all other resources have been reasonably exhausted. NMT does not require prior authorization. We also have some additional reminders. For Medi-Cal enrollees, you must report any changes, such as changes in address, family size, and income, to your county social services office within 10 days. And even if it has been more than 10 days, you should still report the change. Lastly, here are some QR codes and links to resources including the Benefits Cal website to apply for Medi-Cal, the Covered California application website, the Covered California Shop and Compare tool, as well as the AJ SoCal Health Access Resources page. Thank you for watching our health coverage, enrollment, and utilization educational series presented by the Health Access Program from Asian Americans Advancing Justice, Southern California, sponsored by Cedars-Sinai.